Really sorry, everyone. Good morning. I was held up outside because my badge seemed to be incorrect and they didn't allow me inside for a time. So I was late. And a very good morning. So we have this course today, which we've already started off with an excellent talk. And the idea was to decide, with all these gamut of refractive surgery procedures. So we have a stellar faculty and who will be talking on things that they do best. And we have in order these faculties lined up on the various topics. And I was going to speak on introducing the course and how we choose procedures. We all are aware of how refractive surgeries have evolved over time, and it's been a very exciting journey. It's been a long journey. One might think that it came up only 10, 15, 20 years back, but long back, there were refractive surgeries being done. And today we have access to many different things. We might call it all as LASIK, but frankly, LASIK probably occupies a very small part of what we do in refractive surgery today. FDA approvals have come over the years, and you know that PRK was approved almost for a very long back, and then LASIK, and then SMILE about 5-6 years back. And of course, we started doing phakic IOLs almost 15-20 years back, but toric ICLs probably became available in the US only this year, or I'm not very sure, but they still weren't available till last year. And then refractive lens exchange, which has always been a difficult topic to discuss for all refractive surgeons, whether to do it or not. And today, I think broadly, these are the procedures which are available to us, and they do, kind of justify that different patients need different procedures and not one procedure will fit all. So how do you select the right procedure for your patient? I think it all depends a lot also on factors which are sometimes beyond our control. So availability of equipments to your practice, like you might have access only to maybe LASIK, some may have only access to PRK, they may not have invested in a microkeratome. The surgeon's preferences may be different. Some surgeons are sold to doing only SMILE, some are sold to doing only PRK, and some are convinced that Contura vision is the best, and the threshold for doing phakic lens is also very variable between surgeons. So next would be the patient's preferences. Many times you want to offer a procedure to the patient, but the patient has read up on Google and decided he wants a particular procedure, and he may find you based on what procedure he would prefer, and in spite of what he may be actually fit for, you may not be able to offer him the correct procedure for him, and you may actually lose the patient if you try to push him the other way. And also, of course, the patient's parameters. Now, this should be the most important factor to decide, but sometimes it is not. What are the patient's parameters and what are the indications? So equipment availability, again, as I said, it may be a shared facility. You may be living in a town which does not have access, or you may have all the procedures available to you, as in some good top centers. And whether you have an excimer or microkeratome or a femtosecond laser or a Visumax or similar, or a different lenticule machine. Now there are almost 4 machines available for making SMILE-like lenticules. And then, of course, phakic lenses, which actually are available to everyone, but somehow the penetration has not been great, in spite of the fact that they are one of the most useful procedures in refractive surgery and don't require any investment in a machine. And so Dr. Sonu Goel will be trying to talk about this. So I think when it comes to surgeon preferences, as I said, convictions and equipment availability and personal experience play a big role. At what time or stage of this thing did you train, and what all whom you trained under may make a difference, and then what your results do will also make a lot of difference. Industry, of course, keeps trying to push you into different directions, and you have to take a judgment on your own. And then country-specific factors. In Japan, LASIK is not done at all. They kind of banned LASIK because, so it could be depending on which country you live in, that what procedure might work. Or for example, surface procedures in the European, Mediterranean area, they get a lot of haze. So there are so many preferences which may happen because of regional specific preferences as well. And as I said, patient preferences, their expectations from the procedure, their occupation, their interests. Of course, when Google educates patients, and much of it is now paid Google advertising and not actual search, and information which has been fed to patients by various counselors that they contact, and so it always is a challenge. So coming to these 3 broad procedures which are laser based, and range of corrections available with PRK. I prefer to do a lot of PRK as well, and I'm happy to do it for myopic corrections up to 6 or 7 diopters. I don't like to go beyond 100 microns, but there are centers like LVP which are doing much beyond this and still not reporting significant haze. I do also now correct astigmatism. It seems to work well. So PRK has come a long way with some of the newer thoughts that are there. SMILE has been around for many years now, and we've all got excellent results with SMILE, and frankly, this is the procedure which occupies the biggest chunk of my practice today. and you can correct up to -12 of myopic corrections, including astigmatism up to -5. However, it might be best for myopia between -1, 1.5 to -10. And for higher corrections, SMILE tends to offer better stability than LASIK, and of course better biomechanical stability as well. And we all heard about SMILE from Sri Ganesh, so I will not delve more on that. And LASIK, of course, remains the gold standard for all procedures. It can almost treat almost everything. And in fact, very small corrections, I would still want to do LASIK. There are patients who come to you with 6/9 vision. They have to qualify for a medical exam. And I would probably not do SMILE or PRK for them. Although most people would do PRK for small corrections, I find that the visual outcome and faster recovery with LASIK allows you to get much better outcomes for very small corrections as compared to the other procedures. So PRK pros and cons, I think PRK, of course, we understand no flap, no interface complications, very good biomechanics. I think this is where PRK probably scores the highest, even though we might think SMILE is very good, but I still feel PRK has better biomechanics than SMILE. Minimally invasive. And then cons, of course, patient discomfort, which has been tackled to a large extent now, and I use AccuVeil or the new product from Endot, which is forgetting the name, but it is similar to AccuVeil, and you can use that for contact lens soaked, and with that, and PRK pain is gone. Risk of haze is very less with appropriate use of mitomycin, but still remains, and you may get surprises once in a while, and slower visual recovery. SMILE has already taken place, and Sri Ganesh has already spoken to you on this. So my most important thing with SMILE remains that the biomechanical stability is way better, because you're leaving behind an intact Bowman's and an anterior stroma, so the strength is much more. Almost no risk of flap complications, almost much less dry eye. And I think most important is quick rehabilitation and almost no precautions for the patient. Post-op, I hardly have anything to tell them. With LASIK, we keep telling them, don't touch like this, don't rub like this, don't sleep like that, don't do this and don't do that. And, patients are usually warned for at least a week or two. In SMILE, frankly, on day one, I don't have much to tell them. And most patients actually do 6/6 on day one itself. So minimal precautions. Cons, of course, again, Sri Ganesh has spoken about. Enhancements are now easy to do with SMILE. Customized treatments are not possible. And cyclotorsion control only on the newer equipments might become available now. And of course, it's much more expensive. This is where I think the story stops for SMILE. Only a few centers can afford it, and very high running costs. So if that was not the case, I think SMILE would be having much bigger numbers almost all over the place. So LASIK, I think full range of treatments possible, faster rehabilitation than PRK and SMILE. Query SMILE, because now SMILE gives me almost equal or even better, because patient comfort is much more. And then excellent track record, and customizations and enhancements are easy to perform, and easy access to surgeons because machines are available everywhere. It's been around for so many years, and much cheaper to run. But then this is what you may lose sleep over, and they are not uncommon. Once in a while you will come across one of these complications, and I think this is something which, once you start doing SMILE, you kind of forget about all these things. Most of these things are not possible. I'll continue with